Okay, let's go.
What if I told you that some of the most dramatic mood swings, the kind we immediately think of as bipolar disorder, weren't actually psychiatric at all? It's a fascinating idea, right? Today, we're diving into a kind of medical mystery, a situation where a physical illness can literally disguise itself as a mental one. And trust me, getting this diagnosis right can change absolutely everything. So, let's just start with this question, this puzzle. When is bipolar disorder not bipolar disorder? I know, it sounds like a riddle, doesn't it? But the answer? Well, the answer reveals something incredibly profound about that deep connection between our minds and our bodies. So, yeah, let's unpack this. All right, so let's get right into this confusing connection. Picture this, someone gets diagnosed with a physical illness. Could be a neurological thing, maybe a hormonal imbalance. Then, boom, seemingly out of nowhere, their whole personality seems to shift. They're hit with these intense mood swings, they have all this boundless energy, they're irritable. These are all the classic signs of a manic episode. You can just imagine how confusing and, frankly, how distressing that would be for them and their family. And this quote, this really frames the challenge perfectly. Think about it. These mood symptoms, they're basically like a fever. A fever just screams, hey, something is wrong here, but it doesn't tell you what is wrong. You still have to find the underlying infection to actually treat it. And that's the real detective work here, finding that physical condition that's pulling all the strings behind the scene. Okay, so if it's not the classic bipolar disorder we all know about, then what do we call it? Well, as you'd probably guess, medicine has a very specific official name for this. Let's take a look. And there you have it, bipolar and related disorder due to another medical condition. That last part is everything. The key word is direct. This isn't just someone feeling sad or anxious because they're sick. No, this is a direct physiological result. The physical illness is literally, physically, changing the way their brain is working. And listen, this is not just some abstract theoretical idea. It is linked to very specific, very real medical conditions. Take Cushing's disease, for example. It floods your body with the stress hormone cortisol, which can absolutely trigger mania. Or think about conditions that directly impact the brain itself, like multiple sclerosis, a stroke, or even a traumatic brain injury. All of these are known culprits that can set off these exact kinds of symptoms. So the big question is, how do doctors even begin to untangle this super complex picture? Well, to get the diagnosis right, they rely on 5 specific diagnostic keys. You can really think of it like a checklist they go through to make sure nothing gets missed. This lays out the process perfectly. Okay, step 1. You've got to have that clear, persistent shift in mood and energy, that classic manic or hypomanic state. Step 2, and this is the absolute linchpin. There has to be clear evidence. We're talking lab tests, physical exams, patient history, something that directly links those symptoms to a medical condition. Then, you have to rule out other mental disorders. After that, you've got to make sure the person isn't in a state of delirium. And finally, step 5. These symptoms have to be severe enough to be causing real distress or messing up their daily life. As you can see, it's a really thorough and careful process. Another huge piece of the puzzle is timing. It's absolutely crucial. For doctors to make this call, the mood symptoms usually have to pop up within about a month of when the medical condition started. That close timeline, that's really powerful evidence that one thing is directly causing the other. But, making this kind of diagnosis isn't just about ticking off boxes on a list. A massive part of the job is playing detective, right? It's all about ruling out all the other things that could be causing these exact same symptoms. And here we get to one of the biggest challenges a doctor faces in this situation. Are the symptoms coming from the illness itself or from the medication being used to treat the illness? Think about it. Corticosteroids, like prednisone, are famous for causing mood changes, even full-blown mania. So it takes some really careful clinical judgment to tease all that apart and figure out what the real root cause is. And it's not just about the medication question. Doctors also have to consider other conditions that can look really similar. For example, what if that agitated state is actually delirium, that sudden confusion you can get when you're really sick? Or maybe it's something called excited catatonia, which is a movement disorder. Or hey, it could even be a state of just severe acute anxiety. The reason this is so important is that each of those things needs a totally different treatment plan. Getting it right is absolutely vital. Alright, so once the diagnosis is finally confirmed, what's next? Well, this is where the story often takes a very different and honestly a much more hopeful turn compared to a primary bipolar disorder diagnosis. And here it is, the single most important thing to know about treatment. Priority 1 is simple. Treat the underlying medical condition. You have to go for the root of the problem, not just the symptoms that are showing up on the surface. And honestly, this is the best part. In so many cases, once that underlying medical issue is treated successfully, once the Cushing's disease is in remission, for instance, the bipolar-like symptoms, they often just fade away and they don't come back. The fever breaks because the infection has finally been cured. So what does this all mean? It brings us right back to where we started. This diagnosis, bipolar due to a medical condition, it's so much more than just a label. It's this powerful reminder that our mental health does not exist in a vacuum. Our brain is a physical organ, right? It's just as vulnerable to physical problems as our heart or our lungs. And it just goes to show you that the line we so often try to draw between mental and physical health, maybe it isn't really a line at all. Maybe it's just one deep, inseparable connection.